Do you think most people have to hit rock bottom before they are willing to accept any sort of help?
Well, I don't know that they have to hit bottom, because you can never know where bottom is till afterwards. But what I think is true is that most people seek treatment when they're confronted with adversity. And that adversity may come from the family saying, we're not going to support you anymore, we're not going to pay for your apartment, we're not going to support your drug habit. Or that adversity could come from a car accident or a medical illness. We see many people, especially the ones who are in their 40s and 50s, where the adversity is a medical problem. They're told that they have liver disease or congestive heart failure or malignant hypertension that can't be controlled because they're drinking, and they realize they have to do something about it because they don't want to die. They may not want to stop drinking, but they don't want to die. So there's usually pressure that forces the person to rethink their drug use. And that could be that they're a binge drinker, but they got into a bad car accident where somebody was almost killed, and so now they're very worried. And so it's having a discussion with someone and saying, in what way would your life be better if you were to stop? You know why, tell me why you use. Well, I use because I'm anxious, I use because I like getting high, I use because I have no friends. I mean, there's lots of reasons. I use because the sex feels better. There's lots of reasons people give us for why they use. So what we have to ask them is, well, what would be better if you stopped? Because that's really where you have to get them to if you want them to consider treatment. But for most people, there's a consequence. We see a lot of people who are high-level executives where the first wake-up call is their boss saying, you can't come to work tomorrow, or forget doing those lines of coke on the desk. And people who become addicted, their behavior is so impulsive, and they think that nobody notices. They believe that they're invisible in their drug abuse. So, I think that, I can't say that people have to hit bottom, but I can say most people are getting a shove. They're getting moved toward treatment.
Do you think interventions are an effective tactic?
There are different kinds of interventions, but there are certain things in common to interventions that I think are really positive. Prior to an intervention, many families just don't have the information or the tools to mobilize a relative into treatment. So part of what happens before an intervention is families get taught what works and what doesn't work. And they get taught about their codependent behaviors and their enabling behaviors that are making the situation worse. And that's a wake-up call, because most families don't see it. They don't really get how they're making it worse. The other thing is that in a lot of families, fear is a big reason why they don't do something about their relative's addiction. Fear that it'll make it worse, fear that they'll get hit or abused, fear that the individual will lose their job and then they won't have money for the rent. So there are lots of things that keep families from acting, but they all come down to fear. And so usually a skilled interventionist can help the person become much more realistic about what they should or shouldn't be afraid of and how to manage that, so that a good interventionist is able to help a family overcome its fear about what's going to happen next. The other problem is most families have trouble with a plan. Which treatment center do they go to? How do I pay for that treatment center? What kind of treatment does my relative need? Because not all treatment centers are the same. It promises we do a lot of work to treat people with depression and anxiety, post-traumatic stress disorder, sexual compulsivity, but not every treatment center has those kinds of resources. And so, families say, well, even if I do this, how do I know where to send them? And so again, an interventionist can help them by helping them know where the person's going to go and that it's a good fit for that individual, that it'll be a program that's likely to have a positive effect. So I think those are the positive sides of intervention. Now there are interventions that are called invitational, where the person's told, your family needs to have this sit-down meeting with you. They want to talk to you and they want to tell you what they feel about your drug abuse. And that invitational style, tends to be very effective. But there are a lot of people who won't accept the invitation. And so then you get into more of a confrontational style of intervention, or what's called the Johnson style interventions, where the person's not told there's going to be an intervention, and where they're kind of ambushed by the family, still out of love, but clearly where they're not part of that planning process. And I think that when people have concerns about interventions, a lot of concerns are about the Johnson style interventions because they tend to be more confrontational. The truth is that drug and alcohol dependency is a life-threatening illness, and relatives need to be prepared to do whatever necessary to try to help their relative get treatment. And when imitational approaches don't work, even in that style of intervention, it escalates to a more confrontational type of intervention. So I think interventions can be life-saving, and I think even when interventions fail, a family is educated and knows much better what they need to do.